Everybody hi. Virtual direct supervision is evolving from an emergency workaround into a core feature of modern outpatient and rehabilitation care across many health systems. Current regulation in many countries now allow supervising clinicians to be immediately available via secure real-time audio-video rather than being physically present on site, fundamentally changing how oversight is organized. The most visible examples is the 2026 reform in the United States, where national payment rules formally recognize virtual direct supervision in outpatient and rehab settings, illustrating a broader trend in high-income health systems toward digitally enabled supervision. Hybrid presence, regulation meets AI. Within these contemporary frameworks, a qualified clinician can remotely supervise diagnostic and therapeutic services, provided they can join the encounter in real time and intervene promptly. In the US, recent rulemaking for 2026 explicitly embeds this model into national reimbursement policy for many outpatient services, including cardiac and pulmonary rehabilitation, signaling that virtual presence is now regarded as clinically and administratively acceptable. As the developed health systems are moving in the same direction, updating professional standards and telehealth regulations to align immediate availability with secure audio-video connectivity rather than strict physical co-location. Digital platforms increasingly incorporate ambient clinical intelligence, ACI, which passively captures the encounter and auto-generated structured compliance-ready documentation. Real-time algorithms can highlight potential safety issues deviating from protocol or missed guideline-based opportunities, thereby reducing clerical workload and cognitive burden, allowing the supervising clinician to concentrate on high-value clinical decisions instead of manual data entry. Data precision in rehab and chronic care. In rehabilitation and chronic disease management, virtual supervision is being strengthened by computer vision, CV, and biometric analytics. During a video-based rehab sessions, CV tools can track joint angles, posture, and gain symmetry frame by frame, detecting subtle compensations or early overload that may escape even an experienced clinician's eye. Each supervised contact becomes both an intervention and a high-resolution functional assessment, enriching longitudinal data sets that support individualized goal setting and progression. For patients with cardiovascular disease, chronic obstructive pulmonary disease, and other long-term conditions, predictive models integrate continuous or high-frequency data from wearable and home devices. This enables more precise adjustment of medications and therapy intensity, moving beyond episodic vital signs and retrospective symptom recall. Supervising clinicians gain access to real-time risk scores and trajectory curves, combining immediate virtual availability with immediate analytical insight. Optimizing access and economics in diverse systems. Virtual supervision directly addresses geographic inequalities by enabling specialists to oversee care in rural or otherwise underserved areas that cannot sustain full-time on-site expertise. Local teams, nurses, physicians, associates, physical and occupational therapists can interact with AI-enabled clinical decision support during live session, which surfaces evidence-based suggestions and standardized protocols at the point of care. The US 2026 reform can be seen as a proof of concept in a large, complex system, but similar models are being piloted or scaled in other developed countries under different payers and regulatory structures. From a financial perspective, contemporary payment frameworks in high-income settings increasingly recognize telehealth and remote supervision within existing fee schedules or bundled payments, relaxing the requirement for constant physical presence while maintaining payment for established rehabilitation and diagnostic services allows staffing leverage, as one supervising clinician can cover multiple sessions or sites virtually, improving productivity and lowering the effective supervision cost per visit. Greater capacity and schedule flexibility, enabling extended hours and sustainable low-volume sessions that would otherwise be financially marginal. Lower indirect costs, SACI, and related tools reduce documentation time and after-hours charting, supporting clinician well-being and retention. Guardrails, infrastructure, safety, and accountability. These models depend on robust digital infrastructure and well-defined safeguards. Automated triage and decision rules help determine which patients and scenarios are appropriate for virtually supervised care and which require in-person evaluation from the outset. Threshold-based alerts and risk scores can route concerning findings to urgent review, maintaining safety while benefiting from the reach of remote supervision. From an accountability standpoint, generative AI and SCI systems can continuously document supervisory presence, automatically time-stamping interactions, recommendations, and key clinical decisions. This strengthens the audit trails around immediate availability and supports compliance with diverse national regulations on supervision and incidental or delegated services, while reducing the likelihood of documentation gaps that might affect reimbursement or medical legal defensibility. Toward continuous maintenance and functional recovery. As virtual supervision converges with remote patient monitoring and home-based rehab, care can shift from isolated encounters to a continuous maintenance paradigm. Modern analytical models compare expected versus observed progress and flag early signs of plateau or deterioration, prompting timely adjustments to exercise prescriptions, lifestyle interventions, or pharmacotherapy. Across developed health systems, including but not limited to the 2026 US example, virtual direct supervision is thus evolving from a temporary telehealth work around into a proactive engine for maintaining function and independence. By combining clinician expertise, AI-driven insight, and flexible regulatory frameworks, this model promises care that is more precise, more accessible, and more sustainable for complex outpatient populations. Thanks for likes and sharing.